Next, we have the Border Network for Human Rights and Centros Sin Fronteras, who will be talking about their organization as well as the concerns that they have with the school district.
Thank you all so much for allowing us to speak out about this, because we are very adamant about this subject. First of all, I'm Rosemary Rojas. I am with the Border Agricultural Workers Project. I'm president of the Mesa Directiva, and also with the Border Women's Project that advocates for the women, the migrant women, the farm worker women here on the border. I'm also Apache and Yaqui descent. I'm an indigenous woman, and I was a child farm worker that traveled and did the rotation of the crops. So this is not new. This has been my life. On February 1st, we made a public and an open letter to the city, the county, and state authorities, and the institution, as well as the El Paso Independent School District and other border school districts and education officials. And so I want to read from that statement in that open letter. As the coronavirus pandemic continues to spread in our border community, with the average of 481 positive test results for the past month of January alone, the vaccine represents a hope for many people and many communities like ours to try to contain the contagion that continues to cause much suffering and death. El Paso received thousands of doses to be used to vaccinate first responders, healthcare providers, teachers, adults over 65, and people over 16 with underlying condition. Yet, this plan seems to be failing the borderland community, as many members of our own and allied organizations have become aware of the problem and inconsistency with the vaccination process in El Paso. This all ties in together. There has not been a straightforward and transparent accountability regarding vaccines and vaccinations. The community has not been clearly informed on how many doses exactly the borderland received, how many and who exactly have been vaccinated so far. That is, who and how many have received the first dose and how many have received both doses. An exact explanation of the vaccine, the vaccination plan of action, that is, and how, where is the city conducting the vaccinations, what is working, what needs to be fixed, and the process to have access to the vaccination for those who want it, qualify, and according to these established categories. The reports on the vaccination process has not been presented to the community either. There seems to be people who qualified that are not receiving vaccination, and the people who do not qualify have received even both doses. It's good that many people have been able to have access to the vaccine, even though they're not on the priority list. But at the same time, the vaccination strategy must ensure that the exclusion suffered by the groups that are most marginalized and who have suffered disproportionately the effects of the pandemic does not continue. The excluded, the marginalized sectors of our community, single mothers, farm workers, the elderly, our migrant communities, and people with disabilities and families without migrant status must be added to prioritize categories of the vaccination plan. Meanwhile, El Paso Independent School District and other school districts have reopened schools partially, will begin to reopen them soon without the proper resources and enforcement systems to enact their safety protocol. Some schools do not even have necessary resources to safely conduct in-person education, which puts the community at large at risk of contracting the coronavirus. Also, vaccination of the administrative staff and teachers seems to be a haphazard process, with some teachers receiving vaccinations while others are left to wait for the longest time without an apparent explanation or reason, even after sending in their application multiple times. Furthermore, the measure of certain percentage of hospitalization as guidelines for school activities seems to be interrupted at the convenience by the El Paso Independent School District and other school districts, creating concerns for the pupil community, their families, as well as the docent body and school personnel. It is also making many wonder about the truth of the coronavirus impact statistics and how factual they really are. Because of this, the state affairs regarding the COVID-19 vaccination process in the borderland, the From People to People Economic Emergency Fund Coalition formed the Border Network for Human Rights by the Border Network for Human Rights, by the Border Agricultural Workers, and the Peace and Justice Ministry of the Diocese of El Paso, together with other allied organizations, demand the following. Number one, community accountability of the vaccination process. We want to know how many vaccine doses were received by the city of El Paso, where they've been allocated, and how many and who from the stipulated category for the vaccination have received the double dosages and how many have only received one. Number two, assurance of compliance with the established categories. We want the city to make sure that the individuals who qualify for the vaccine according to the criteria established for group 1A, 1B receive the vaccine before any other individuals who are outside those categories do. The Border Farm Workers Center submitted a list of prioritized farm workers who continue to work in the fields and are therefore at high risk, and has helped farm workers who are over 65 who have underlying health conditions to register for the vaccine, but none of them up to date have been called nor received the vaccine. This is unacceptable. Our farm workers are mothers, fathers, grandmothers, and they have students in the system. Number three, access to the vaccination for all those who want and qualified without any exclusion. Again, as in the requested above, just some of the farm workers and single mothers, the elderly, families with members with no legal immigration status have been systematically excluded of a system of prevention protection during the pandemic crisis. Vaccinations must be guaranteed to all those who qualified according to the pre-established categories and would like to receive the vaccine. Registration has been an issue. Should be made easy as possible to take into account those who do not have access to the internet. Many still carry the Obama phones issued. Also, vaccination sites should increase and their location should be easily accessible. Number four, access to the vaccination, establishing diverse forms to guarantee access to the most marginalized sectors. While plans for the establishment of strategic central points for mass vaccinations are crucial to facilitate access to the population, it is important necessary to test other systems to ensure that no one is excluded. An example would be the use of mobile units that can take the vaccine to workplaces such as the agricultural fields, to the barrios, the colonias, and residents who do not have the means of transportation to access consolidated massive vaccination site. Finally, in connection with all these demands expressed from People to People Fund Coalition, fully supports the demand of the El Paso Teachers Union for the protection of the lives of the teachers and all the school employees, as well as the students and their families, and also stands with Familias Unidas Chamizal, and we support their denouncement of the lack of safety in the school for a return to the in-person education approach. Together with them, we believe the return is hasty and safe until all school personnel, teachers, have received their full immunization for COVID-19, including the janitors, the kitchen, the help, all the support system that could not exist. The function of the school could not exist without these women, without these men, these bus drivers that are the foundation of transporting and taking care and feeding our children. We accept these demands. We expect them. We expect all our demands to be implemented immediately for the arrival of the next vaccination allocation, for the sake of the health of those at risk and the overall safety of our border community. We remain watchful of how the vaccination process continues to unfold in El Paso, the surrounding areas, and on behalf of our membership and constituents. Respectfully, the Border Network for Human Rights, the Border Agricultural Workers Project, the Peace and Justice Ministry, Proyecto Mujeres Fronterizas, the Border Women's Project, and other border organizations and community leaders. And just to close, I want to add that it's not for the lack of parent involvement in all these issues they have been fighting for years. It has been there. They have been promised things and the discussion has never gotten further. The superintendent has never been in a discussion with them. It has continued to be a systemic racism that is not new to us as Indigenous and border immigrants and people that live in this border region, as mothers, as fathers, as brothers and sisters. We are proficient in our language. We choose to speak both, and some of us 3 or 4 languages. So it's not for the lack of enforcing better English skills in our homes. No, it's not. It's the lack of resources to address these issues. We have gone beyond just talking about it, bringing it up, making false promises, and turn it into actions now. That is what we want to see. That is a commitment we want to see from those that we elect, and we will hold accountable. Can I go ahead and ask my first question?
Yes, please.
I want to know from each one, what is your opinion about the vaccination of all teachers, all school personnel, cooks, janitors, maintenance, bus drivers, etc., and of all the students and their families before the massive start of face-to-face classes?
Thank you. And for this question, we're going to limit the answer to 1 minute, if that's okay, Rosemary. I think that should be enough
Yes.
for candidates to answer you. Again, if you forget what the question is, please ask us. We are looking for very direct answers to the questions. These organizations are very grounded in community. And so out of respect to them, please answer the question as directly as you possibly can. Thank you so much. And we're going to go ahead. The first candidate to answer will be from District 4, Ms. Frances de Santos Whitaker.
Yes, I truly believe that all teachers and school personnel should be vaccinated. Unfortunately, you're right, we don't know where these vaccines are going or how many we're receiving. It would be beneficial, I believe, to work with a pharmacy or any community organization that could get us the vaccines and perhaps have them in our feeder schools. So within our feeder pattern. So bring the kid, maybe choose the high school and have a vaccination clinic there where everyone can get vaccinated, including the parents and the students that are able to.
Thank you for that. Next, we have Mr. Feyneau Pierre, also from District 4.
Absolutely. Teachers, students, staff, that include bus drivers, the folks that actually maintain our building. So if elected, I will advocate for them to be vaccinated or at least have access to vaccinations. And also, I also will address lack of PPE. I'm well aware of that. I would highly encourage you to visit my website, check out my platform. You can check out Feyneau for EPISD.com. So it's all laid out on my platform. So I fully support the vaccinations of our staff, students, teachers, and EPISD's workers. Absolutely.
Thank you. Next, Ms. Betty Ann Halliburton, also District 4.
Unfortunately, because the CDC National had their plans dismantled before the pandemic, they're having to scramble to do their organization. So therefore, the states and the cities are having the same thing. They're creating the rules as they go along. So this last implementation says that they will have a site that everybody can go to regardless of their age. So the teachers will be able to be a priority. In our community, everybody wants to be priority and get the vaccination. So it's a matter of location. When people can't get to the area, then they don't get the things that they need. So hopefully that will be worked out with the city and the city's health department so that these adults can be vaccinated. keep in mind that children are still being tested as to what vaccination they need. So let's hope that rolls out a little bit quicker than it's supposed to. Thank you.
Thank you. Next, we have from District 5, Vanessa Betts.
Yes, this is a great concern. Yes, I do feel that the teachers and the support staff, including everyone, such as the bus driver and the secretary so far, need to be included. Everyone needs to be included. I don't know how feasible it is to get everyone included within this school year. And yet there has to be a plan for that because our children are suffering from this fluctuation in school, out of school, online, offline, hybrid, so there has to be a plan that will work for everyone. But right now I say that all of our teachers and all of our support staff have to be vaccinated. And then we need to consider our students as well, especially those who may have underlying conditions. And yes, and the elderly.
Thank you. Next, we have Jerome Tillman, candidate for District 5 as well.
Yeah, the virus does not discriminate. Therefore, its implementation needs to be done in a cohort. Whoever you introduce into the community of education needs to be prioritized in terms of receiving the vaccine. So you cannot talk about the teacher without talking about the support staff. I haven't heard a lot of conversation about the nurses, and I'd like to make sure that they are emphasized as well, because the first manifestation of an illness in the classroom, the student is going to be dispatched to the nurse. So look at how the nurse might be bombarded with several different exposure types, and that we need to pay specific attention to the medical staff that we have on the campuses. But again, the virus does not discriminate. If you put people in that same community on that same campus, they should all have the same priority in terms of being vaccinated. Last thing I'll say is a lot of this needs to be a good marriage between the city, the county, and the school districts, because the management of the health distribution system.
That is time. Thank you, Mr. Tillman. Thank you. Next, we have Willetta Corbett.
The pandemic, of course, has been difficult in so many layers and ways. I would like to thank the Border Network for Human Rights, Familias Unidas, these kinds of community organizations, keeping an eye out, staying vigilant, giving our communities of this great city a voice, and bringing these issues to parties that can hopefully do something about it. This is the type of community engagement that's necessary. So I agree with one of the speakers, designate a high school or a site in all of our districts, utilize our nurses, perhaps a staff to get them there, because the priority is our school personnel must be vaccinated, have to be vaccinated. End of sentence. They are essential. They are the first responders of our community in the education sector. So that's a priority. And I do think that we can do that, having spots within the school district that families.
Ms. Corbett, time is up.
Thank you. Next, we have District 1, Arturo Dominguez.
I have already stated that our schools need to be open. Students need to get back to the classroom. But we need to have a plan, and there's no plan from the district. Our district has influence. It has a lot of power. So I'm advocating for the district itself to push, to work on behalf of the teachers and the staff at each school in order to reopen the schools and get back to normal. I'd like to make it short, but straight to the point. I really appreciate, this is one of the main points. Thank you.
Thank you. Next, we have Leah Hanani, District 1.
So as Familias Unidas mentioned earlier, students need schools open, and those that are impacted most greatly are the ones that were already struggling in terms of students. So we have to acknowledge this is a fluid situation. it requires swift collaboration. So as mitigators, I'm calling for access to testing, collecting accurate and centralized data on cases in schools and areas for contact tracing, following federal guidance on safe facilities and waivers for employees who need them. As far as vaccine, we should be pushing legislatively for employees to be included in Group 1B. Isleta was able to partner with the city and has thousands of their employees vaccinated, so we know this is a leadership issue. But we also need to acknowledge that when our most vulnerable is last to get vaccinated community-wide, we're hastening a crisis both in and out of our schools. Again, this is a leadership issue and one that can be assisted with collaboration between city and school organization entities. Thank you.
Thank you. Thank you for that. Next, we have District 3, Josh Acevedo.
So I'm going to try to say this in 1 minute. There's so much that I have on this, but I think one of the biggest things that we've been doing is we've been partnering with UMC, with Immunize El Paso, with UTEP to vaccinate our employees. We've had over 1,100 employees vaccinated, 260 substitutes, and we just finished our partnership with UMC, and they vaccinated all our special ed teachers. So, so far we've vaccinated those that qualify under 1A and 1B. And we've been asking the states to make us a vaccine provider. We've been checking on a weekly basis to see if they approve us. They've been focusing on mega sites, so they're not allowing that. So UTEP's a vaccine provider, Isleta's a vaccine provider, and we've been trying to do what we can to vaccinate our most vulnerable populations that qualify now. At the same time, we have been open for a month. We haven't had a positive case. We also have a dashboard online that I was shocked, frankly, last year when they launched it, because it was one of the most transparent things that EPISD has done. And I thought that was
Mr. Acevedo, your time is up.
so far. Right now, we're going to continue working to get more rapid tests. And hopefully the state will let us vaccinate our teachers because they want us to open the school.
Mr. Acevedo, your time is up. Thank you.
Thank you. Back to Ms. Rosemary Rojas. You have another question. For this one, we can do 2 minutes if you'd like, or 1 minute. It's up to you.
Yes. Given the answers that we've heard right now, and I want to emphasize that language justice is at the top of that, and it should be implemented with the teaching. It should not be forced back on the community. We are already doing that and have been actively doing that for decades. If you agree that everyone must be vaccinated, what is the concrete plan to achieve it? Not more discussion. What is the concrete plan? We can talk until we're blue, but we need actions now and commitment to those actions. Thank you.
Thank you. And so, yes, please answer that question directly. And the first one up will be District 3 incumbent, Josh Acevedo.
So I'm glad that you asked this question. I think right now I do have some trust in the leadership taking the approach to being able to vaccinate as many of our employees as possible. I think that CDC guidelines, Dr. Fauci have said we could open schools and do it in a safe way without vaccinating. But I still think that everybody would feel much safer if they were in our schools and they were vaccinated. And that I feel that has been the primary key to doing it. I do commend Congresswoman Escobar in trying to get a FEMA site here to El Paso for our most vulnerable populations. That's a step in the right direction. I'm also thinking that now that the racist is out of the White House, the Biden administration has done a good job in rolling out this vaccine and getting more shots in arms, over 50 million in the first month. And I think that is good. And so as a district, I think we need to continue advocating with the state and saying, you know, if you want to open the schools, we need you to give us the resources and let us be a vaccine provider. And
thank you very much. Your time is up.
For this question, we're going to go ahead and do 2 minutes since we have a little bit more time.
Oh, my apologies.
That's okay.
Go ahead, Mr. Acevedo.
Okay, sorry. So yeah, and as far as, you know, the protocols that we have in place at schools, we are providing all the safety measures that we can, providing that social distance. There have been some issues at schools, and I've brought those to the attention of the interim superintendent. Anything that's come to my my attention, But also, I think it's really important to note that our schools are really old, and we've done some stuff with our ventilation, and that's what concerns me the most about opening our schools and doing it in a safe way. But we are doing everything that we can to have those protocols in place. And like I said, I think the people that have been vaccinated are feeling a lot better. They're in that vulnerable state. We also accommodated many of our employees, didn't make them go back if they needed those accommodations. At this point, we only have 7 employees that have requested further accommodations past February 18th. So I think that has been a great thing that we've done at the district.
Thank you. Next, we have Mr. Jerome Tillman. Again, if you need the question to be asked again, please let us know.
Yeah, I think the feeder pattern strategy is a great idea. You have an infrastructure in place already, and that as the vaccines become available, that the distribution system include the in-place network we have in the education system. Again, there's got to be a marriage between the health services administrators, between the city and the county and school districts. That's what needs to happen. As the vaccines become available, you have a protocol in place. For us, I think using the feeder patterns is the best way to go. It's already in place, it's already organized. And I'm going to go back to my comment regarding the nurses and the other medical staff in the school system. We have got to give them a greater focus, a greater priority, and they need to be better resourced to help with the vaccination dissemination.
Thank you. Next, we have Ms. Willetta Corbett.
I think the biggest part of this plan that this concrete plan, number one, is to change the category so that we need to influence the legislature, we need to influence city, any other official, even the commissioner. I heard, I was watching a video and he would not respond to including teachers as part of the 1B category, but put it on the legislature. So we need to have a campaign to attack that so that the 1B category includes our essential workers, the first responders in the education realm, our non-certified staffs. Secondly, I really believe we have to work within the district on this designated site. There has got to be 1 or 2 campuses that can be so designated, whether it's for after school, which gives them that additional learning time because of the enormous learning loss that the pandemic has incurred. And secondly, it can be that kind of site where vaccinations can take place. And so that we get more use out of our facilities, because the district has also lost money because of all the things that they've had to do to let students go back into the classroom. They've had to have sanitization of the buildings. They've had to buy additional materials. They've had to acknowledge that there was meals that they had to send out and the technology that the students use. So it's a balance. There are things we have to do, but we've already committed our funding. Perhaps, you know, that's the equity issue. What's the priority? And we need a strong leader to help set that.
Thank you. Next, District 1 candidates, Leah Hanani.
So I think this is largely a city-state issue, but there are going to be ways that we can provide cooperative assistance. And a lot of these things the candidates have already mentioned. As Josh stated, we should become a vaccine provider. There's going to be ways that we can use the infrastructure in place to provide vaccines. A big thing is that we need to push sites to create a system that is not online only for registration. We know that a lot of people do not have access to the internet. Also, I think it would be maybe feasible to have walk-up registration for the elderly in our community. So we're talking about vaccinating a larger group of people in our communities. And then, of course, pushing for 1B consideration so that our teachers and employees are considered essential employees, considered the essential employees they are. Thank you.
Next, we have District 1 candidate Arturo Dominguez.
Yes. What do you know? I have a plan. Schools within every district should have a vaccination center where the teachers students, people around those schools can get vaccinated. We must have individuals from the county health unit assigned to those particular centers and have them vaccinated. What's so difficult? It's a matter of having a plan and getting over it and work with it. District should have the opportunity to assist and help teachers in order to become vaccinated, because that's the main idea, to have a priority for teachers so we can get back to normal as soon as we can and have those students learning at the curriculum. Schools should provide proper social distance between students and maybe even attend class from school and from home. But that would be the best plan that we can have in order to assist and help the teachers open up our schools. Thank you.
Thank you. Next, we have District 4 candidates. The first one will be Pino Pierre.
School safety is a top priority on my platform. And again, you can visit my website, for EPISD.com. School safety, I mean, all those great ideas we just mentioned and listed cost money. So that's why, if elected, I will advocate with the state rep, our state reps, our senator, to have more money to make sure that within our district, we can provide vaccinations and proper PPE for students, teachers, and staff. All those things cost money. So we can just, I mean, it's not just simply having a plan to address this disparity in vaccination. So I have a plan. So if elected, it's on my website. It's already posted on my platform that if elected, one of the priorities that I have, I would have to advocate for more money to make sure that we can actually address the disparity that we have. So as we go back to in-learning person, so more of our students and teachers and staff can be vaccinated, they can feel safe, and we can provide the best education so our EPISD student can strive for excellence. So I'm advocating for those things. Vaccination is a top priority. I have a plan. If elected, I will work with other trustees and the superintendent to make sure that we have more money. We have a plan. I mean, I have a plan. So that's all. And thank you. And check my website if you're interested, and check out my plan for vaccinations.
Thank you. Next, we have Ms. Betty Ann Halliburton.
Good evening again. I want to address the situation about a plan. When I go to EPISD.org, they have a plan for reopening schools. They have a plan for sanitizing those schools, and they're following that plan. Now, possibly to improve their publicity with the public, they probably should publish the plan and have it available to all the students and teachers and parents so that they know. So there is a plan in place. We just need to read it. Thank you.
Thank you. And next we have Francis de Santos Whitaker.
Yes, as far as a concrete plan, since former Vice President Pence signed that teachers are essential workers back in August, we need to start at the top. So we have Veronica Escobar. She's a great advocate for us. And so we can start there, and then even involve Senator Blanco in the Texas Senate, and to get our feeder schools involved so that we can get vaccinations for all the feeder patterns without them having to register. It'll be a type of vaccination where maybe we could, start with a certain amount of a certain group, and then it would be families so that the entire family can get vaccinated at the same time. And then we'll just continue through each feeder pattern so that everyone will be able to be vaccinated in the El Paso Independent School District.